Carisoprodol is a commonly prescribed muscle relaxant that is used to treat acute musculoskeletal pain. In this video, we will explore the various uses of Carisoprodol, its potential side effects, and important safety considerations. What is Carisoprodol? Carisoprodol, also known by its brand name Soma, is a muscle relaxant that acts on the central nervous system to relieve muscle pain and discomfort. It works by blocking pain sensations between the nerves and the brain, providing relief from muscle spasms and discomfort. Carisoprodol is classified as a Schedule IV controlled substance due to its potential for abuse and addiction. Uses of Carisoprodol. Carisoprodol is primarily prescribed for the short-term treatment of acute musculoskeletal pain. It is commonly used to alleviate pain caused by muscle injuries, sprains, strains, and other musculoskeletal conditions. Carisoprodol is often prescribed in combination with rest, physical therapy, and other measures to help patients recover from their injuries more effectively. In addition to its muscle relaxant properties, Carisoprodol also has sedative effects. This can be beneficial for individuals who experience muscle spasms that cause significant pain and discomfort, as it helps to relax the muscles and reduce pain sensations. However, it's important to note that Carisoprodol should only be used for short periods, as it can lead to dependence and withdrawal symptoms with prolonged use. Common side effects of Carisoprodol. Like any medication, Carisoprodol can cause side effects. The most common side effects include drowsiness, dizziness, and headache. These side effects are usually mild and tend to diminish as the body adjusts to the medication. It is recommended to avoid driving or operating heavy machinery until you know how Carisoprodol affects you, as it can impair your ability to perform these tasks safely. Other common side effects may include nausea, upset stomach, and dry mouth. These side effects are generally temporary and may subside with continued use of the medication. If these side effects become bothersome or persistent, it is advisable to consult your healthcare provider for further guidance. Rare but serious side effects of Carisoprodol. While rare, some individuals may experience more serious side effects when taking Carisoprodol. These side effects should be reported to a healthcare professional immediately. They include allergic reactions, such as rash, itching, swelling, or severe dizziness, severe weakness, difficulty breathing, and loss of coordination. It is crucial to seek medical attention promptly if any of these symptoms occur. In some cases, Carisoprodol may also cause a condition known as serotonin syndrome. This is a potentially life-threatening condition that occurs when there is an excess of serotonin in the body. Symptoms of serotonin syndrome may include agitation, hallucinations, rapid heartbeat, fever, muscle stiffness, tremor, and in extreme cases, seizures. If you experience any of these symptoms, it is important to seek immediate medical attention. Precautions and safety considerations when taking Carisoprodol. To ensure your safety when taking Carisoprodol, it is important to follow your healthcare provider's instructions carefully. Here are some key precautions and safety considerations to keep in mind. Medical history. Inform your healthcare provider about any pre-existing medical conditions, including liver or kidney disease, epilepsy or seizure disorder, porphyria, and a history of drug or alcohol addiction. These conditions may affect your suitability for Carisoprodol treatment. Allergies. If you are allergic to Carisoprodol or any other medications, it is essential to inform your healthcare provider. Allergic reactions to Carisoprodol can be severe and may require immediate medical attention. Pregnancy and breastfeeding. Carisoprodol is not recommended for use during pregnancy, as it may pose risks to the developing fetus. It is also not recommended for use while breastfeeding, as Carisoprodol can pass into breast milk and may harm the nursing infant. Consult your healthcare provider for alternative treatments if you are pregnant or breastfeeding. Drug interactions. Carisoprodol can interact with other medications, including opioids, benzodiazepines, and certain antidepressants. These interactions can increase the risk of severe sedation, respiratory depression, and other adverse effects. Be sure to inform your healthcare provider about all the medications you are currently taking, including over-the-counter drugs and herbal supplements. Dependence and withdrawal. Carisoprodol has the potential for dependence and withdrawal symptoms, especially with long-term use. It is important to follow your healthcare provider's instructions regarding the duration of treatment and to avoid sudden discontinuation of the medication. If you have a history of substance abuse or addiction, it is crucial to discuss this with your healthcare provider before starting Carisoprodol. How to take Carisoprodol properly. To maximize the benefits of Carisoprodol and minimize the risk of side effects, it is important to take the medication as prescribed. Here are some general guidelines for taking Carisoprodol. Dosage. Take Carisoprodol exactly as prescribed by your healthcare provider. Do not take more or less than the recommended dose, and do not take it more frequently than prescribed. Timing. Carisoprodol is usually taken 3 times a day and at bedtime. Follow your healthcare provider's instructions regarding the timing of doses. Duration. Carisoprodol is typically prescribed for short-term use, usually for a few weeks. It is not recommended for long-term use due to the risk of dependence and withdrawal symptoms. Food and drink. Carisoprodol can be taken with or without food. However, it may cause drowsiness, so it is advisable to avoid alcohol and other sedatives while taking the medication. Missed dose. If you miss a dose of Carisoprodol, take it as soon as you remember. However, if it is close to the time for your next dose, skip the missed dose and continue with your regular dosing schedule. Do not double the dose to make up for a missed one. Alternative treatments for muscle spasms and pain. While Carisoprodol can be effective for the treatment of acute musculoskeletal pain, it is not the only option available. There are alternative treatments that can help alleviate muscle spasms and pain. These include physical therapy. Physical therapy can help improve muscle strength and flexibility, reduce pain, and promote healing. A physical therapist can develop a personalized treatment plan to address your specific needs and goals. Non-steroidal anti-inflammatory drugs, NSAIDs. NSAIDs, such as ibuprofen and naproxen, can help reduce inflammation and relieve pain associated with muscle spasms. These medications are available over the counter or by prescription, depending on the strength. Heat and cold therapy. Applying heat or cold to the affected area can help relax muscles and reduce pain. Heat therapy, such as warm compresses or heating pads, can help increase blood flow and promote relaxation. Cold therapy, such as ice packs or cold compresses, can help reduce inflammation and numb the area. Topical creams and ointments. Topical creams and ointments containing ingredients such as menthol or capsaicin can provide temporary relief from muscle pain and spasms when applied directly to the affected area. Acupuncture. Acupuncture involves the insertion of thin needles into specific points on the body to promote pain relief and relaxation. It is believed to stimulate the release of endorphins, which are natural pain-relieving chemicals. It is important to consult with your healthcare provider to determine the most appropriate treatment option for your specific condition. Frequently asked questions about Carisoprodol. Is Carisoprodol addictive? Carisoprodol has the potential for dependence and addiction, especially with prolonged use or abuse. It is important to follow your healthcare provider's instructions and use Carisoprodol only as prescribed. Can I drive or operate machinery while taking Carisoprodol? Carisoprodol can cause drowsiness and impair your ability to drive or operate machinery safely. It is recommended to avoid these activities until you know how Carisoprodol affects you. Can I drink alcohol while taking Carisoprodol? It is advisable to avoid alcohol while taking Carisoprodol, as it can increase the risk of drowsiness and other side effects. Can I take Carisoprodol if I am pregnant or breastfeeding? Carisoprodol is not recommended for use during pregnancy or breastfeeding, as it may pose risks to the developing fetus or nursing infant. Consult your healthcare provider for alternative treatments. What should I do if I miss a dose of Carisoprodol? If you miss a dose, take it as soon as you remember. However, if it is close to the time for your next dose, skip the missed dose and continue with your regular dosing schedule. Do not double the dose to make up for a missed one. Conclusion. Carisoprodol is a commonly prescribed muscle relaxant that provides relief from acute musculoskeletal pain. While it can be effective in alleviating muscle spasms and discomfort, it is important to be aware of its potential side effects and safety considerations. Follow your healthcare provider's instructions carefully, discuss your medical history and any other medications you are taking, and be mindful of the risks of dependence and withdrawal. Remember that there are alternative treatments available for muscle spasms and pain, and it is important to consult with your healthcare provider to determine the most suitable option for your specific condition.